Hello, welcome to our Speech-Language Pathology information session. I'm Rhonda Richter, Graduate Admission Counselor at Lewis University. I'm here with Dr. Tina Veal, Chair and Founding Program Director of Lewis University's Speech-Language Pathology Program. Here are the objectives that we'd like to share with you about the Speech-Language Pathology Program. Dr. Tina Veal will be explaining to you what an SLP is and some of the other objectives such as career outlook and the program here at Lewis University. Lewis University is located in Romeoville, Illinois. We have approximately 6,400 students and about 1,200 of them are living on campus. The program is currently part of an initiative by the university looking to expand graduate programs in the health sciences here at Lewis University.
One of the important things to know about Lewis University is that we're a Catholic and Lasallian university. Many people don't know what the Lasallian values are, but they're very important to us here, and they're reflected in our teaching methods. And basically, this is a method of teaching that values all people from all faith backgrounds and all walks of life. And we believe that all learners should have equal dignity and respect. Our teachers here very much love their students and care for them and mentor them along when they're struggling. This is a very socially engaged learning platform, and what we mean by that is that we are going to train speech-language pathologists in the community to engage with populations of people with communication and swallowing disorders. Our campus was designated years ago as a sanctified zone, and what this means is that everyone is respected here on the Romeoville campus of Lewis University. And so it is a safe place and a sanctified place to study. We have a commitment to work in association with one another. And so faculty and students partner together in the learning enterprise. And when you're a graduate of the Lewis University Speech-Language Pathology program or any program at Lewis University, your commitment is to extend these Lasallian values into the world. And we hope that you will do that when you complete the program here. So now we're going to talk a little bit about the discipline of speech-language pathology, because while some of you know all about this, if you have parents or significant others who are listening in, they may not understand completely what it means to become a speech-language pathologist. So we're going to review this briefly. A speech-language pathologist is a professional who works with people of all ages on communication and swallowing issues. The responsibilities of the speech-language pathologist include assessing communication and swallowing issues. If we get a referral and someone is suspected of having one of these kinds of problems, we do the professional evaluation to determine if treatment is necessary. And then, of course, the hallmark of our trade is doing treatment or intervention for communication and swallowing problems. And these are the two areas that we're most known for. But we also work to prevent communication and swallowing problems, and we conduct research, and we advocate on behalf of our clients. One of the great things about speech-language pathology is that you can work in so many different settings. I often tell students that if you get a degree in speech-language pathology, you should never want to change your career, because you can literally retool to work with different populations or work in different environments. The most common settings are schools and healthcare settings. About half of all speech-language pathologists work in schools, mostly public schools. But there are also preschools and private schools that SLPs may work within. SLPs also work in hospitals, private speech-language pathology clinics and nonprofit agencies, and other healthcare facilities, such as nursing homes or retirement facilities. And some SLPs work in the home with early intervention services or home health services following hospitalization. Our scope of practice is vast, and this is why SLPs need a master's degree to enter the field. We work on articulation disorders. These are speech problems, and anyone who has speech that is inarticulate or difficult to understand, which can be caused by a variety of conditions that you see here displayed in this slide, may be referred for an assessment and likely intervention so that we can help them speak more clearly. Fluency disorders are stuttering and cluttering. And this is, many people know what stuttering is, and this is something that usually manifests in childhood, but can persist into the adult years. But cluttering is a disorder that a lot of people don't know very much about. And this basically is a disorder of timing, where people run their words together so that the pace of speech makes it very difficult to understand. Voice and resonance disorders is another main practice area. A voice disorder can be many different kinds of problems with the voice, but it is caused by a difficulty at the level of the vocal cords. And so anything that causes pathology in the vocal cords will cause a problem with the quality of the voice production. And this can be a very big problem for individuals such as teachers or singers or actors who use their voice as part of their vocation. Disorders of resonance, on the other hand, involve how sound resonates through your head, your specific head and neck cavity. And some people have hypernasal speech or hyponasal speech and other kinds of resonance issues that SLPs also can address. Receptive and expressive language problems is one of the largest areas of practice for speech-language pathologists. People of all ages can have difficulty with their language comprehension, what they understand about what they hear other people saying, and with language production, being able to think of the words you want to say and put them into sentences that are grammatically correct and communicate the message that we want. Also in the area of receptive and expressive language are literacy issues, and speech-language pathologists help children and adults learn how to read with comprehension and learn how to read aloud fluently. And we also work on writing and spelling skills. Hearing is an area that speech-language pathologists work with as well. Mainly in our scope of practice, we conduct hearing screenings at schools and healthcare facilities for children and adults. Anytime an individual fails a hearing screening, we refer them for a more comprehensive evaluation with a professional audiologist. After an individual is determined to have hearing loss and has been fit with a hearing aid or a cochlear implant, speech-language pathologists conduct oral rehabilitation. This is therapy to address the unique communication problems of individuals with hearing loss who have amplification. SLPs also work in the area of feeding and swallowing. Many times young children, from the time they're babies or toddlers, have difficulty feeding either from a bottle or taking food from a spoon. Sometimes they have trouble with swallowing. And there are all different kinds of swallowing problems, which are outlined here a little bit on the slide. And so we do work to help individuals move food around in their mouth and swallow it safely, whether it's a child or an adult. Social communication is another major practice area. And this is the art of being able to use the language, the words that you have, as a social tool to communicate with other people and socialize. Language was designed to be a social medium for human beings, and this is how we interact with one another. But if we don't understand how to do that, our words are not very useful to us. So many times children and adults will have difficulty using their language effectively for social means, and we work on that as speech-language pathologists. Cognitive communication is another large area of practice. The cognitive communication refers to the executive functions that support communication. These are housed in the frontal lobe of the brain, and many times, again, people with plenty of language to work with just have trouble using it very effectively in order to plan, initiate, sequence, problem solve, and stay with the tasks that they're working on. This area also includes attention, intelligence, and memory, and any or all of these areas may be impacted in children with developmental disabilities and in adults who've had neurological insults. So the SLP can help with all of these skills. Augmentative and alternative communication, often referred to as AAC, is an area of practice which involves being able to assess and recommend an augmentative or alternative communication system when an individual is having difficulty communicating through verbal means. So if someone is losing their speech for some reason, their ability to verbalize due to a neurological disorder, or in a young child, if they're having difficulty developing verbal speech, we often will evaluate that individual and recommend a voice output device or a low-tech kind of communication system, such as sign language or using some symbol-based modality. So that's a little bit about the vast scope of practice, all the many areas that an individual might specialize in speech-language pathology. The entry-level SLP has to be familiar with all of these general practice areas that we just covered. Now let's talk about how you become an SLP and what the professional practice requirements are to enter this discipline. All speech-language pathologists must have a master's degree at minimum to enter the field. You can have a master's degree in communication sciences and disorders, CSD, or in speech-language pathology, SLP. It really just depends on how the university decides to name the degree. As long as it's from an accredited program at a university or college, that is the credential that you will need to get licensed to become an SLP. You do have to pass a national board exam, which is given through the Educational Testing Service, and it's known as the Praxis 2 exam in speech-language pathology. The program at Lewis will prepare you to take this exam and pass it. We have 2 review courses, which students do not have to pay anything extra for, but do have to sit in order to help pass this exam. And that's one of the features of our program. You have the other entry-level requirements to enter the field in speech-language pathology. After you get your master's degree and you pass the national board exam, you need a state license. This is the legal credential to practice in any state. And so whatever state you're going to conduct services in, you need a state license. So we will prepare you to apply for your state license here in Illinois or in another state where you plan to reside for your first job. Most states have some kind of school certification or licensure. In Illinois, there is a professional educator license that you must have in order to practice as a speech-language pathologist in the Illinois public schools. While this is changing, and soon we will not need this extra credential in addition to our state license, right now we do need to prepare you to have that for your first year in the field. So our program is designed to do that. And then there's the ultimate certification in speech-language pathology is the American Speech-Language Hearing Association Certificate of Clinical Competence, or Asha CCC. At the completion of the program at Lewis University, you will be prepared to apply for your Asha CCC, which is the credential that is known throughout the world as the preeminent certification to be a speech-language pathologist. So here's just a little bit about the state license in Illinois and the requirements that you have to have in order to get that. I'm not going to go over these in detail here, but they are in the slides so you can make reference to them. The program at Lewis prepares you, and we track all of these requirements for each and every student to make sure that everyone is on track to have a state license, again, in Illinois or in other states of residence. The Illinois school licensure through the Illinois State Board of Education is called the Professional Educator License, and you get that in addition to the speech-language pathologist endorsement, which is the non-teaching endorsement to work with children from pre-kindergarten up through individuals who are age 21 years of age. Again, this is very similar requirements to the state license in Illinois, and we are clocking and tracking each one of these requirements to make sure that anyone who comes to school at Lewis University can meet these requirements so that you can get the license that you need to work in the Illinois public schools. This is the slide about Asha Certification, and we are an Asha accredited program, and as such we will of course meet all of the Asha certification requirements so that students will be ready to obtain Asha CCC SLP upon completion of our program. After graduating from Lewis or anywhere else, individuals must complete a nine-month period of supervised employment with an Asha certified supervisor. This is called the clinical fellowship year, and so everyone applies to Asha right upon graduation, and then at the 9-month point after this supervised period of full-time employment, you apply to Asha to gain your Asha CCC SLP. So here's what everybody's always interested in. Can you get a job in the field that you are gaining your degree in? And I'm happy to tell you that for speech-language pathologists, we have been able to place 95% or more of our graduates for 40 years. So the outlook has just continued to be more and more and more for speech-language pathology for the last 4 decades and beyond. But right now, that's the time when you will be looking to enter a program and graduate, so this is what you're interested in. We do have about 145,000 speech-language pathologists on the job in the United States, and the Bureau of Labor Statistics has estimated that we will grow by 18% in this 10-year period that they were examining through 2026. And this is a much faster than average job growth than the average jobs on the market. You can see here our median salaries, and bearing in mind these are not starting salaries, these are the median salaries of speech-language pathologists, but you can expect to earn a good living as a speech-language pathologist whether you work in the schools or in the healthcare settings. As I mentioned before, speech-language pathology graduates get jobs. Right now, the average of all programs, we track this, every program has to track this, 98% of all graduates with a master's degree in speech-language pathology are employed within 3 months of graduation. And it's hard to find a higher statistic than that, no matter what discipline you're in. We do have about a little over 190,000 Asha members. Almost 160,000 of them are speech-language pathologists. We share Asha with our audiologist colleagues, and so that's why the number is less than 191,000. And as you can see, there's 900 individuals in Asha who hold the certification in audiology and speech-language pathology. Why is it that speech-language pathology is growing so rapidly? Well, it's because we have an ever-aging population. This is a good thing because we have good health care in the United States. We have higher survival rates all the time for premature infants and people who've had trauma or strokes. And so there are a lot of people who need our services who are in these populations. We have better identification and more early identification of pediatric communication disorders. And we have more children than ever who are qualifying for special education in our school systems. There's always an increasing need for contract services by hospitals, schools, and nursing care. And also, we have many more bilingual clients living in the United States than ever before. And managing 2 languages at a time can be particularly challenging in the young child. And so many children and adults as well seek the services of a speech-language pathologist when they speak 2 or more languages. So now let's talk about the program here at Lewis University. So our vision for our program here at Lewis University is unique, as all visions are for programs at different universities. And this is something you should always keep your eye on when you're looking for a program to attend. But our vision is that Lewis speech-language pathologists will work hand in hand with families, educators, and healthcare providers to offer compassionate, holistic care to people with communication and swallowing disorders. Upholding the dignity of all people, they will enhance their ability to dialogue, learn, and work in association with one another. You'll notice that this vision is very much articulated with the mission of Lewis University as a Lasallian university. We ground this vision in our mission as a program, which is again aligned with the Lasallian values and mission of the university proper. Our mission is that SLP students at Lewis University will dedicate themselves to the highest ethical and practice standards of the discipline of speech-language pathology. They will distinguish themselves as transformative, culturally informed, and socially responsible clinicians. They will advance the discipline by helping others understand the devastating impact of communication and swallowing disorders, identifying underserved populations, and forging new pathways to meet their needs. So our curriculum is designed to deliver on this mission. It is a 24-month to degree completion program that results in the award of the Master of Science in Speech-Language Pathology degree. This is a full-time residential program. Like most programs in the United States, most of our classes and our clinical practicum do occur from 8 to 5 during the weekdays. We will not have weekend classes. I believe that students need that time to be able to get their work done and prepare for the clients that they're going to be serving. So we do not hold evening classes or weekend classes, but we do expect to be able to schedule you in classes and clinic during the day, during the week. We do have a hybrid delivery of our didactic curriculum. So we have some online and some face-to-face courses. Most of the courses are face-to-face. They may have they may have an online element to them, however. And some of our summer courses particularly will be delivered online. We have a front-loaded content, and this basically means that we seek to teach you the disorders courses, the information that you need to know before we schedule you with a client with that disorder to the best of our ability. There's a lot of flexibility in clinical practicum, and there's a lot of intensity to our clinical practicum. Students will be in the field more hours than usual for the clinical practicum at Lewis University. Our innovative clinical education model is based heavily on service learning. We have identified places in our community near the Romeoville campus where speech-language pathology services are needed but not available. And our speech-language pathology faculty will be partnering with our students to provide services in those locations. So we are actually taking speech-language pathology services into places in our community where they're needed, desperately needed, but not provided. And this is where you will learn how the art of speech-language pathology side by side with faculty members. This is very unusual. Most of the time, if practicum is delivered in the community, it's delivered with community-based SLPs, which is a great way to learn, but students are often more comfortable first learning with the faculty that they have in the classroom. So that's what we are planning to do. Students will also have a community-based placement at the end of their program, one in a school and one in a healthcare facility. And in those two, those will be very traditional practicum placements in which students will work with a community-based speech-language pathologist. So here's a curriculum map of year one. We will start in the summer of 2020, and every subsequent year thereafter, the program, each cohort will launch in the summer. So students start together and graduate together in this program. The unique thing about our curriculum is that we have divided each semester, as you see here, into 2 blocks or 2 terms. In the summer, these are 6-week terms, and in the fall and spring, they're 8-week terms. And you will see that the first term is mostly coursework, particularly if you put your eyes on fall 1. You'll see that those first 3 courses, child language, adult language, and speech sound disorders, are all didactic or academic courses. This is where you learn the knowledge that you need and practice a few skills that you're going to need for clinic. Then the second term is a clinical methods class that you will take on campus, and then clinical practicum, the service learning mini rotation model that I mentioned. So at least 2 days a week, and for many students, 3 days a week, you will be in the field with a faculty member conducting clinical practicum and applying those skills that you learned in the first 8-week term. I call this the learn it, do it model. Learn it in the first term, do it in the second term. In my experience, graduate students who struggle in speech-language pathology often do so because they say it's really hard to take on graduate coursework at the same time that they're preparing for their very first clients. So here you can intensively take your classes in your first term and then turn your attention just to clinical, just to learning the art of being a clinician in the second term and practicing that art. This is the rest of the curriculum map for the inaugural cohort. Year 2, very much like year 1. So how do you apply to the MSSLP program at Lewis University? Well, the prerequisites for application are that you have a bachelor's degree either in communication sciences and disorders or any field. So you can actually have a bachelor's degree in anything as long as you have these other prerequisites. Now, all students, whether you have the communication sciences and disorders degree or a bachelor's degree in another field, we will survey your transcripts to make sure that you have these 8 prerequisites. 4 of them are within our discipline. We have a pretty short list of discipline-specific prerequisites, and the reason for this is because in our graduate coursework, we cover everything else. And so we do need you to have a course in phonetics, and as SLP students know, phonetics is a transcription system that we use in order to be able to code how someone is speaking. So you need that skill. You need that course in phonetics. You need a course in speech and language development. Our course here is entitled Speech Language Feeding Development because we do touch on that, but this basically is normal development of speech and language in children. You need that normal development course. Then you need a course in anatomy and physiology of the speech and hearing mechanisms. This Again, all of these need to come out of a communication sciences and disorders or speech language pathology department. And this anatomy and physiology course is specific to the speech and hearing production. Then you need a class in speech and hearing science. Sometimes this is called language science. So speech science, language science, hearing science, we're looking for one or all of those kinds of courses. You don't have to have all of them, just a course in the science behind speech and hearing production. So those are your 4 discipline-specific prereqs. And then there are 4 gen ed kind of prerequisites that are outside the department, that come from the general curriculum of the university. You need a course in biological science. This should be a course in biology, anatomy and general anatomy and physiology, genetics. There are a couple of other courses that count, but it's not like a course in environmental biology or something of that nature. It has to be specific to human biology, or veterinary science also counts. You need a course in physical science, and Asha specifies that this must be chemistry or physics. So you need a course in chemistry or physics. You need a course in social science. This one's usually not hard for SLP students to come up with. A class in psychology, a class in social work. There are actually quite a lot of others that qualify here too. And a standalone course in statistics. Now, the important thing to know about these prerequisites is that you need the grade of C or above for these to count. And this is Asha's rule for what will count toward your certification. So this is a rule everywhere in every program across the country, but students often are unaware of that. So make sure you have the grade of C, not C minus. Anything C minus or below, you have to retake these classes in order for them to count as prerequisites for application. So these are your 8 prerequisites that will allow you to apply to our program. The application process here is similar to most programs in the United States. We do use the Centralized Application Service, CIDCAS, and the link is right there. Our cycle opens in July and it ends, the deadline is February 1st. If you're thinking of applying for our inaugural cohort, that's the application deadline. You need to have your CIDCAS application submitted by February 1st. It does take CIDCAS about a month to review and verify your file, and then we can begin evaluating it here at Lewis University. It is important to get your materials submitted as early as possible. We begin the review process of CIDCAS applications in October, and we continue until all of our seats are filled. At Lewis University, after we do an initial file review of the materials you've submitted, we invite a limited number of candidates to campus for a personal interview. This is required for admission to the MSSLP program at Lewis University. This is a little bit about me, which might be the most boring part of the whole presentation, but basically what I'd like you to know about me is I'm very excited to be here at Lewis University. This is the 3rd program that I have founded, and so I'm very pleased to be able to develop this program in alignment with the incredible ethical and ethics-based values that Lewis University espouses and puts into practice every day, and to be able to train speech-language pathologists who will be socially responsible, culturally informed, and who will go forward from Lewis University to transform the discipline, taking our services to places that they're needed but not available. So at this time, we usually take questions if we're in a live session, but I'd like to invite you to certainly reach out to the Office of Admissions in order to ask any questions that you have. They can certainly answer many of the questions. Rhonda can answer so many of the questions, and if not, she finds me, and we will certainly get back to you with any questions that you might have.
You can call me, Rhonda, at 815-836-5811, or you can email me at richterh@louisu.edu. Thank you for spending the time with us today.